Hi guys, my name is Dr. Lee Sung. Welcome to my YouTube channel. Picture this situation very clearly. A young man or an adult thinks everything is fine with his health. No pain, no obvious problem, everything feels normal. But inside the body, slow and silent changes are happening because of daily habits that seem harmless. And the most dangerous part of these changes is this: they do not appear overnight. They build up over months and years. Today's discussion is not about fear. It is about science, awareness, and prevention. Because in medical science, especially in urology, one truth is repeated again and again. Most long-term problems are not sudden. They are created by repeated small mistakes. So let's go step by step in a deep, detailed, and realistic way, understanding what actually damages penile health over time, according to general urology knowledge and clinical observations. One of the first and most overlooked problems is poor hygiene habits. The human body naturally produces sweat, oils, and normal bacterial flora in the genital area. This is completely normal. But when cleaning is neglected for long periods, this natural balance gets disturbed. Dirt, sweat, and dead skin cells can accumulate and create irritation. Over time, this can lead to discomfort, itching, and sometimes infections. But here's something very important that many people do not understand. Overcleaning is also harmful. Some individuals use strong soaps, antiseptic liquids, or chemical-based washes repeatedly, thinking they are improving hygiene. Scientifically, this is incorrect. The skin in that area is sensitive, and excessive chemical exposure removes natural protective oils. When that barrier weakens, the skin becomes dry, irritated, and more vulnerable. So the correct approach is balance. Simple, gentle cleaning with water is often enough. And if soap is used, it should be mild and non-irritating. Now let's move to another silent but very common issue: tight clothing and lack of airflow. The male genital area is designed by nature to function in a temperature-sensitive environment. When someone constantly wears very tight underwear or very tight jeans for long hours, the temperature in that region increases. Heat and moisture also increase due to reduced airflow. From a biological and dermatological point of view, this environment can sometimes encourage irritation and fungal growth. The skin may feel uncomfortable, sweaty, or itchy. Over time, continuous heat and pressure can also reduce overall comfort and sensitivity. This does not mean tight clothes are always dangerous, but constant restriction without breaks is not healthy. The body needs ventilation and comfort to maintain normal function. Now we come to something extremely important in modern lifestyle: sedentary habits and long sitting hours. Many people spend most of their days sitting, in offices, cars, or in front of screens. Long sitting reduces circulation in the lower body. Blood flow is extremely important for all tissues, including reproductive organs. When circulation is reduced repeatedly, it can contribute to discomfort and overall reduced physical wellness. This is why medical professionals often recommend movement, stretching, and short breaks during long sitting periods. It is not just about fitness, it is about maintaining healthy circulation. Next, we need to talk about a very important topic that is often ignored due to embarrassment or delay: ignoring early warning signs from the body. The body never remains silent when something is wrong. Pain, burning sensations, swelling, unusual discharge, or changes in normal appearance are signals. The problem is that many people delay seeking help due to hesitation or fear. In urology, one of the most common issues seen is delayed consultation. A condition that could have been treated easily in early stages becomes more complicated because it was ignored. This is not about panic, it is about awareness. Early attention always leads to simpler solutions. Another major factor that affects long-term health is lifestyle choices like smoking, poor sleep, and unhealthy diet. Let's understand this scientifically. Smoking affects blood vessels. Blood vessels are responsible for delivering oxygen and nutrients to all tissues in the body. When blood vessels are damaged or narrowed over time, circulation becomes less efficient. Similarly, lack of sleep affects hormone balance and recovery systems of the body. Sleep is not just rest, it is biological repair time. Poor sleep over long periods can weaken overall physical health. A diet high in processed food and low in nutrients can also impact energy levels, circulation, and tissue health. The body needs vitamins, minerals, and proper hydration to function optimally. So when we combine smoking, poor sleep, stress, and unhealthy eating, the result is not immediate damage, but gradual weakening of overall body performance, including reproductive health. Now let's discuss another very important and sensitive area: unsafe sexual practices and lack of protection. From a medical medical standpoint, safe practices are essential for preventing infections. Infections can sometimes cause short-term discomfort, but in some cases, if untreated, they can lead to long-term complications. That is why medical professionals always emphasize responsibility and protection. This is not about judgment, it is about health awareness. Just like we protect ourselves from physical injuries, we also protect ourselves from biological risks. Now, an often ignored but very real factor is excessive mental stress and anxiety. Stress affects the entire body through hormonal pathways. When stress becomes chronic, it can affect energy levels, sleep quality, and overall physical performance. The body and mind are deeply connected, and long-term stress can indirectly influence multiple systems in the body. That is why relaxation, exercise, and mental balance are not just psychological advice. They are physical health strategies. At this point, it is important to connect all these points together. None of these habits alone usually create immediate serious problems. The real issue is repetition over time. Small daily mistakes accumulate silently. A tight clothing habit here, poor sleep there, ignoring small symptoms, adding stress, lifestyle imbalance, and over months or years, the impact builds up. This is exactly how most long-term health issues develop in real life. Not suddenly, but gradually and silently. The positive side is this: the human body is highly resilient. It has strong healing and recovery ability when given the right conditions. Small corrections in daily habits can lead to significant improvements in long-term health. Simple changes like maintaining hygiene balance, wearing comfortable clothing, staying active, sleeping properly, managing stress, avoiding harmful substances, and paying attention to early symptoms can make a major difference. Medical science consistently shows that prevention is far more effective than treatment. Once damage becomes advanced, treatment may become longer or more complex. But when awareness is applied early, many issues can be prevented completely. So if we summarize everything in a realistic and practical way, the message is very clear. Your body does not need extreme care. It needs consistent basic care done correctly. Not too much, not too little, but balanced. Listen to signals, respect comfort, avoid unnecessary stress on the body, and maintain a healthy lifestyle routine. Because in the end, health is not about fear. It is about understanding your body and making smarter daily choices. And when that understanding becomes part of life, most long-term problems never even get a chance to begin.